Hello to you all. My name is Dr. Isaac Elias, and today I want to talk to you about the danger of pesticides, herbicides, and environmental toxins and how to address them with our new product, GlyphoDetox. Pesticides, herbicides, and environmental toxins are posing true danger to the health of all of us. It's remarkable when we recognize and realize how much pesticides are being used in the United States. In 2012, they found that annually 1.1 billion pounds of pesticides were used in the United States, meaning between 3 and 4 pounds per person. The problem is that pesticides and herbicides accumulate in the environment. We know it from studies on DDT, for example, where DDT has been banned for decades and you still find it in food or in people because it's still present in the environment even if it was banned for decades. It's very different with current pesticides, with glyphosate leading the way. It is accumulating in the environment, accumulating in the soil, and posing increasingly dangerous effect on us. When we look at the use of pesticide in the United States, the leading use of pesticide is corn and soybean, which are above 60% of all use of pesticides. So areas where people live that are close to corn and soybeans are really an issue, but these food sources, unless you get organic sources which are far away from such GMO full of pesticides fields, will also have pesticides. So you can recognize how critical is the issue, and it's getting worse and worse every year. You can see the use by ear and crop. I was quoting 212, and you see that since 212, there's about a 10-15% increase in the amount of pesticides used annually. So you can realize and recognize why I am so concerned about it as a health provider, as a doctor, and as a person that advocates for health of the planet and for our own health. So, some fact from the WHO that naturally has to take a more conservative stand. The WHO recognizes that pesticides are potentially toxic to humans and can harm both acute and chronic health, depending on the quantity and manner in which a person has been exposed. And we just saw in the slide before, in the 2 slides before, how much exposure we have here in the United States. So these are intrinsically toxic, and they deliberately spread in the environment, and they affect us in so many levels. And this is why the WHO recommends regular monitoring of residues in food and the environment, and say that it's required to do such things. But of course, monitoring is one thing, but if you find that there are pesticides, we also need to see what we can do about them. So glyphosate is without a doubt the #1 pesticide used in the United States, by far. In addition, the tolerance levels of certain pesticides, including Roundup, have risen over the years as a result. And as a result of this, more and more pesticides are being used, with a lot of lobbying allowing for higher and higher legal limits that allow more pesticide use. So it's really a vicious cycle, and we are really the victims of this cycle. So glyphosate has been found in foods, in everyday objects, and elsewhere, and you can see it in this slide, right? I mean, in 2016, it shows, traces of glyphosate in the urine of 99.6% of Germans, pretty much 100%. And now actually glyphosate is illegal in Europe. In 2014, 3 out of 10 human milk, breast milk. And we also can see that there were traces of glyphosate in wheat flour, oats, and bread in 14 out of 20 samples analyzed again in Germany. And you can imagine how much worse it's going to be in the United States, where we're using it more often and we're still using it at huge amounts. And even in personal care use like tampons, 85% of sample tampons that's traces of glyphosate, you can imagine the absorption through the vaginal lining straight into the bloodstream. And the effect on OBGYN tumors, for example, or endometriosis, or other inflammatory diseases of the pelvis. So these are just some examples about the prevalence of glyphosate in the environment where it really, has such negative effects, and of course the effects on us. So the environmental and health effects of glyphosates are very important to really recognize. And the main issue is that there is a bioaccumulation. So it's not 1 year, it's 1 year after 1 year after 1 year. It actually will take decades and decades to clear the glyphosate. So glyphosate affects the microbial community, not only in our body, also in the soil. And there is an interdependence and relationship between the quality of the microbiome of the soil, the plants, and the guts of the animals that eat these plants. And guess what? We eat these plants many times. Glyphosate has effect on antibiotic resistance. That now we see antibiotic resistance against bacteria and against fungi. And glyphosate also serves as one of the drivers for antibiotic resistance in general. So you can see the gut effect and the disruption to the microbiome, which is a basic disruption on a planetary level, on an agricultural level, and on the level of our health. So there is a clear association between pesticide residue intake and pregnancy outcome among women undergoing infertility treatments. So it's important. It means that actually glyphosate and pesticides have an effect on the fetus, and in utero and after the fact. And actually the percentage of the probability of live birth was lower in women who were exposed to pesticides compared to women who were not exposed. This is from a Harvard study. So glyphosate has a strong correlation with cancer. And there is a lot of politics here in trying not to announce it formally, and it goes through periods where the WHO recognizes it, and then there's a lot of lobbying against it. We all have experienced this. But meta-relative risk of NHL, non-Hodgkin lymphoma, in people exposed to glyphosate-based herbicide was increased by 41%. So there is a clear correlation specifically between NHL, non-Hodgkin lymphoma, and glyphosate. And just as a side comment, there's also correlation between mercury and lead and NHL, non-Hodgkin lymphoma. When you combine both, and remember, don't live in an isolated environment, we are exposed to pesticide and we are exposed to heavy metals, you get a multiplication of damage. And that's why it's so important to address pesticides on an ongoing basis. So glyphosate also has shown very strong correlation with thyroid cancer. We see almost a parallel line between the increase in glyphosate use in the United States and the increase in the incidence of thyroid cancer. It's kind of amazing how they literally go side by side. What is very concerning is the relationship between glyphosate and autism spectrum disorder in children, ASD. We see a dramatic increase in ASD that is associated with an increase in glyphosate. In California, in the main agricultural region, there was a study done comparing almost 3,000 individuals with ASD, autism spectrum disorder, and including 444 with intellectual disability. They were compared to a very large population of over 35,000 people, matched for sex and age. And the risk of autism spectrum disorder was associated with prenatal exposure to glyphosate. And interesting, exposure in the first year of life increased significantly the odds of the disorder with comorbid intellectual disability by 50%. That's really a scary number. So we can see the correlation between the incidence of use of glyphosate and the incidence of ASD. Now, glyphosate may contribute to autism, the spectrum disorder etiology, by negatively influencing the gut microbiome. And that's a very important thing to really recognize. When we affect the microbiome and we affect the integrity of the gut, it has far-reaching effects on multiple systems in the body. We now recognize the gut-brain connection and the brain-gut connection, how stress and psychological and neurological issues can affect the gut, but even more vice versa, how specific microbiome imbalances will create neuroinflammation and neurological issues, including developmental issues. We really have to appreciate it from a point of view of Chinese medicine, where the gut is involved with physical digestion of food and the brain is involved with mental digestion of information, of thoughts, etc. So there is naturally a relationship between them, and naturally what will damage the gut will damage the brain. And unfortunately the studies are supporting this basic observation and correlation. So glyphosate has this important relationship with celiac disease. We see a very high increase in celiac disease and gluten intolerance worldwide as the glyphosate use is spreading. And it's interesting, in my medical practice over the years, I've repeatedly met patients with celiac disease, gluten intolerance, severe, couldn't eat any bread, any pasta. They fly to Europe, they fly to Italy, they have bread, they have pasta, no problem. They think, wow, I got cured. They come back to the United States, all the symptoms are back. And this is a lot relates to the use of glyphosate by itself, and in addition, probably to the use of GMO wheat. It's important to recognize and know that wheat is sprayed right before the harvest with glyphosate. Now, very worrisome, there is a correlation between age-adjusted end-stage renal disease, ESRD, and glyphosate application in percentage of US corn and soy crops. This is very important to recognize. There is a relationship between the increase of use of glyphosate in soy and corn, and soy protein is often used by patients with chronic kidney disease, and the incidence of chronic kidney disease. And I'm emphasizing it because many people are not aware of the epidemic size problem of CKD. 17% of the US population over the age 65. So if glyphosate, as it shows, is involved with CKD, it can explain why CKD is on a rise year after year after year. This is very close to my heart because of a lot of research that I'm doing in the field of acute kidney injury and chronic kidney disease. So glyphosate can also insert itself into protein synthesis, specifically because it's very similar to glycine, the smallest amino acid. It's because glycine is the smallest amino acid, has unique properties that makes it very flexible, and it has an ability to anchor to plasma membrane on the cytoskeleton. The glyphosate substitution can really explain the link with so many diseases, with such a large array of conditions. Glycine plays a very important role in the brain. It is actually an inhibitory neurotransmitter. It improves mood and cognition. It can help with convulsions and seizures. It can help with relief from pain, insomnia, and headaches. It can help to control obsessive-compulsive disorder symptoms. It can even improve the symptoms of schizophrenia and improve sleep qualities. So we can see its inhibitory essential effects. But when it's replaced with glyphosate, these benefits will not be there anymore. And this is why glyphosate will show excitatory effects and will have detrimental effects on the nervous system, including issues like Alzheimer, dementia, and behavioral issues. So glycine also is a rate-limiting step for glutathione synthesis, the essential antioxidant in our body. So when glycine is replaced by glyphosate, we will have a disruption of the glutathione antioxidant system, and this will not be limited to the liver. The detrimental effect on the function of glutathione will affect multiple tissues, including the brain, including our memory function, and can also explain issues like dementia and like Alzheimer. And we know it because we use glutathione intravenously as treatment in the clinic for this. So let's look which countries are banning glyphosate. As you can see, the list is long. Most of the countries in Europe, including Italy, where my patients go to have their pasta and bread and have no problem until they return. Quite a few countries in the Middle East, and more countries in Asia as well. But in the same time, it is used abundantly here in the United States. So now that we understand how serious is the danger that glyphosate imposes, let's take a look at what we can do about it. And let's talk about GlyphoDetox. GlyphoDetox was designed specifically to address pesticides and agricultural detox. It's a very unique formula because it offers its detox benefits both in the gut and systemically. So the 4 compounds in GlyphoDetox are kelp, organic Icelandic kelp, high molecular weight citrus pectin, different than modified citrus pectin, sodium alginate, and glycine. The kelp, pectin, and alginates form our proprietary binding blend. They give different properties of binding. They have a very wide profile of binding that can bind a large array of pesticides, and in the same time can also bind negatively charged ions such as bromide, chloride, and fluoride, and that's specifically why kelp is added to the formula. Glycine is absorbed systemically, where it supports the detox pathway and exchanges with glyphosate. So you got a powerful system that can bind to glyphosate and prevent its absorption or reabsorption in the gut, while also binding to other toxins, other pesticides, and other heavy metals. And you've got glycine that has a systemic effect. Now, if we look at a specific ingredient, there is research that is linking glycine to higher levels of glutathione, as you can see in this slide. Let's talk for a moment about kelp. Kelp is really the center of the formula. It is what gives life to the formula. So putting this research aside for a second, what do I mean? Kelp has the ability to not only survive, but to thrive in the ocean with changing currents, changing environmental visitors, different fish, different organisms that come around, changing temperatures, changing seasons. How does it do it? It does it by both having a protective effect, a very clear barrier that can withstand all of these things, the ability to bind and remove toxins that are dangerous, and we can see it, and we can see all of these properties in kelp, just like in this study. Kelp enhances intestinal barrier function. As part of its ability to be a good barrier, it will enhance intestinal barrier function and can be critical for the glyphosate-induced celiac disease. So if we look at the properties of kelp, it is able to bind to negatively charged ions such as fluoride, bromide, and chloride, and use the iodine in the kelp to exchange with them inside the body also systemically. It also can bind to different pesticides because of its hyaluronic acid, because of the alginates that are present in it. But in the same time, it also delivers important minerals in healthy ratios. It delivers trace elements. It delivers all the essential amino acid. It can deliver some omega-3 fatty acid and some unique compounds which have immune enhancing effect, such as fucoidan. So you can see how the same plant, the same organism, the way I look at it, has a detoxification properties, but also has a nourishing properties. This adds movement to the GlyphoDetox formula. Also, looking at alginates that are known to have a very broad ability to remove toxin, it was shown that glyphosate was removed from water samples with sodium alginate. So alginates have the ability to bind and absorb and remove glyphosate. And the detoxifying power of pectin is well established. In this formula, we are using a specific pectin, which is very different from modified citrus pectin. It is a high molecular weight citrus pectin with high esterification. And as such, it has a greater capacity of binding and removing fat-soluble toxins, mold toxins, neurotoxins, and pesticides, such as DDT and DDE. So when we combine this together, we got this very powerful binding complex together with glycine. Now, how do we use GlyphoDetox? GlyphoDetox was designed to be used as a standalone daily product. I want to emphasize that this product deserves daily use because we are exposed and we absorb pesticides and glyphosate through our food on a daily basis. But in the same time, we can combine it with other ingredients. In general, even if you are using the GlyphoDetox as a standalone product, always include Pectosol modified citrus pectin in your program for all your patients. When they ask me who should use Pectosol modified citrus pectin, my answer is anyone that is breathing. The fundamental role of Pectosol in blocking galectin-3 has so many health benefits that it's truly unparalleled and has been demonstrated in over 60 peer-reviewed published papers, all of them with positive results. When we look specifically for detoxification and how to combine the different products, again, you can use GlyphoDetox on its own, and then you can combine it with other products. If you want to emphasize or enhance the removal of positively charged heavy metals, lead, mercury, cadmium, nickel, arsenic, cesium, uranium, then you can combine it with Pectosol Metal Detox. It has both a heavy metal detox effect systemically and in the gut, and will prevent the reabsorption. And we showed it, we published it. So that's a very good combination. In times when you want to emphasize the detoxification, either spring or fall, people who follow Chinese medicine, or during time when you are prescribing to your patient a more intense detoxification program where you know that you need to support the phase 1 and phase 2 liver detoxification, you need to support the organs of discharge that will discharge toxins into the bloodstream and elimination that will eliminate them out of the body. This is a good time to combine also Detox Complete. Detox Complete also supports the energy of the different detoxification organs. When you want to emphasize the affinity to toxic areas in the body, when you want to support the connection between the gut and immunity, you can also add the mycoceutics total body support, the combination of the 10 mushrooms with beta-glucan. And this will really create a very unique a very unique program for you. When it comes to your basic detox program, you will have GlyphoDetox with your daily pectasol modified citrus pectin, and you will add our gut transformation product, our microbiome healer, Synergy I. Synergy I is a remarkable product, much beyond just a prebiotic with probiotic. Similar to the Kelp, but even to a greater extent and a greater extreme, it's a product full of life. It's a liquid product where different strains of bacteria, of beneficial bacteria, are fermented on close to 20 different organically grown digestive herbs. And the fuel used to develop this product is organic molasses, which of course is consumed, nothing is left. And you get this powerful fermented prebiotic with probiotic, with organic acid, and then we add to it our proprietary pectinoligosaccharide, low molecular weight pectin. And this creates this very powerful product, which I've used for years on my patients in the clinic, and now I'm so excited to introduce it to my colleagues and to the public because I know it's going to make a big difference. So these three are our basic program that you should do on an ongoing basis, these three. A quick comment about the safety of GlyphoDetox. GlyphoDetox is an extremely safe formula. We don't recommend to use it during pregnancy or while breastfeeding. I'm truly excited to introduce this product that we worked on for a long time. I know that this product will make a big difference for so many people. I want to thank all of you for listening to this webinar, and I hope that you found it useful. Thank you very much.